Who said it? Who said it? Over the past 2 decades, there has been a dramatic increase in methamphetamine and opioid use. And there's only one way to actually beat this or deal with this long term. So let's take it to the board and discuss pros, cons, similarities, differences between all the different types of detox. So let's look at some of the differences between methamphetamine withdrawal and opioid withdrawal. And now, once again, as stated in prior videos, when I say opioid withdrawal, we're going to be covering a broad spectrum of opioids. So let's jump right on into it. So, believe it or not, there are some similarities and differences in regards to the withdrawal. So, with meth withdrawal, first and foremost, let's start with that. What is meth? Is an upper. It's an upper. It activates your central nervous system. It increases heart rate. It in particular can make you where you're not sleeping for days. Basic things like this. Also, it affects your dopamine receptors, right here. Or let's go this way, the dopamine neurochemical. Now with opioids, we're talking anything from morphine to you could even look, tramadol you could put in there as well. You could put in even with that things such as hydrocodone, oxycodone. Same thing, not the same, but similar in ways with the opioids. So with that, it's a downer. They're more downer-ish. Now, they can have an upper effect as well, but all in all, it's more of a downer effect from what I've seen in the psych setting. Some people can have, once again with it though, can have burst of energy as well. It is as well, it affects, I'm going to actually take out receptor. It's the dopamine. It affects the neurochemical of dopamine and sometimes even norepinephrine. We don't exactly know how yet, how they actually affect the receptor sites to an extent. But with it, it is said dopamine, norepinephrine, and when it comes to norepinephrine, that would more so be with like tramadol, for instance, but it can affect as well the norepinephrine and dopamine and even serotonin, just depending on individual to individual. Now as well, downer can have an increased effect though as an upper though too. So a similarity with it, both affect or said to affect your dopamine. Now real quick before I go any further, now if you're wondering dopamine, what is that? That's the pleasure system of the brain. It's the pleasure system of the brain that makes you want to, once again, get more of it. That's the main thing, and that's why it can become as well addictive. But for anyone who is taking something that has a dopamine rush, in particular with that physiological response a lot of times, with that physiological response, it's gonna cause your body to have it's gonna raise the tolerance of a physiological response, and it's gonna make you naturally want more of it. Now, real quick, with both of them as well again, the detox can be done without assistance. Now, this is not for everyone, but in a lot of situations it can be because of the risk of seizures is dramatically decreased. Now, before I go any further with that, can you still have a seizure from opioids or meth? Of course, if you're mixing them together, which happens a lot, or even if you have a history of seizures. So if you have a history of having seizures, if you've had a seizure in the past from even alcohol, you have an increased chance of developing seizures. But if you've never had a seizure before, you have no history of seizures, the good news is a lot of times, the detox can be done at home. However, still in the psych setting is approved because you just have more resources. But we're not focusing on the psych setting, we're focusing on something that can help anyone, just good information to have. Once again, tolerance builds up quickly. So just because you're like, oh, I've run out and I'm gonna detox off, you're gonna have a tough withdrawal regardless. But compared to the next thing is benzos right here, and the point is not to talk about benzos in this episode, but to really just give an idea. If you've been taking benzos for a good amount of time and you've been taking high doses of benzos, you do have a higher chance of developing seizures. Because when you cut off benzos, if you stop them abruptly, especially if you have a history of seizures, but even if you don't, you can have a seizure from that. So a lot of times with benzos, you'd want to taper. But anything that you're taking for a long amount of time, as stated, you're going to have a withdrawal, you have a higher tolerance, and just in general, you still could potentially have seizures. But the good news is a lot of times it can be done without it. But I just wanted to throw that in there with the benzos in general. Now, real quick, another point with tramadol or Ultram. At higher doses, if you're taking this, there is a chance of potentially developing seizures. And in particular, if you've been taking tramadol and you've been drinking with it, the chance goes up even higher. And things such as serotonin syndrome can develop as well, which I'm going to do a full different video on what serotonin syndrome is and how it can affect potentially having seizures. Now, real quick as well, the route of administration right here. Now, with this, I put this because this is key when coming off of anything, or the chances of not having a relapse is the route. So, for example, if you've been injecting, so things such as opioids, let's go with heroin even. If you're injecting heroin, not only do you have a higher chance of developing things such as Hep C from IV drug use, and that's also as well, that can be with anything you're shooting. Injecting is the hardest to quit. And as well with that, a lot of times polysubstance use is used because if you're using something that you're shooting up, and let's just take, for example, let's say you're shooting up meth. You're not going to be sleeping a lot of times for days. You're going to have something that's going to bring you down. So if you've been shooting up meth or using it, a lot of times alcohol is used in conjunction with it. So if you've been using it by mouth or PO compared to shooting, there's going to be a higher chance that that not only the detox won't be as tough if you take the medication by mouth, but also you do also have a higher chance of not relapsing off of it as well. So that's key. That is key. So the route of administration right here. Now another point, meth, higher chance, and this is with side effects in general, GI distress. Higher chance of potentially having things such as constipation or diarrhea right here. But one key with this is when you're coming off of meth, for example, and this can apply, everyone's different. This can apply to opiates and opioids as well. So I don't want anyone to say, oh no, this wasn't for me. I understand, but this is in general what I've seen in the psych setting. And yes, there are situations where other things can occur, but this is just stuff that I see. Now, anxiety, huge. And as well, the hand tremors, and this can go with opiates or opioids, and in particular meth withdrawal. And even when somebody's even on something such as methamphetamine, the shakiness and hand tremors can happen. But for example, the shakes and not being able to sit still is probably one of the #1 side effects that I didn't actually mention in another video from a lot of different types of withdrawal. But in particular, with methamphetamine and opiates and opioids, or even benzos, the handshakes are a big deal. Now, as well, with opiates or opioids, a lot of times if somebody's been using these, you will have been constipated you have a higher chance of having constipation. So a lot of times you're backed up. So when you're coming off of it, or even alcohol, for example, diarrhea. So you need loperamide or even Imodium, which will really help with that. That's big. Now, also, something, and you might be asking, now wait, what's the point of you doing this video? It's to show you that with meth and opioid withdrawal, yes, it is hard. Yes, you will detox. Yes, you will have mental cravings. But ultimately, it a lot of times can be done outside of a psych setting or with doctor's help. Now, granted, you always should, but if you can't, you eliminate things such as seizures in general. However, if you've been using, you're like, oh, nice, I can do this. I've been using meth, but I've been using something else with it, like an upper and downer, like alcohol. Once again, the seizures are a big problem that come into play. So if you're just using meth or an upper, and in particular, or even opioids by themselves, and you might go, wait, what about if I was using meth and I was using, for example, hydrocodone, mixing them together? Yes, developing seizures can obviously happen, but it's still not near to the extent of going through things such as a benzo withdrawal or even alcohol withdrawal. Anytime you add those in with the polysubstance use, that's when more problems can arise. Now, real quick, this is huge, which I want everyone to understand, and I want to pin in your brain real quick. Both, or even let's just go anything that you've been using for a long amount of time, whether that be meth, opioids, medication that causes that dopamine release, you will have a post-acute withdrawal if you've been using something for more than even a couple months daily, but it will be worse if you've been shooting it up or abusing it, the drug or the medication. The mental cravings or the post-acute withdrawal syndrome, which is that's something that's used in the psych setting as applied to opiates or opioids. But post-acute withdrawal can happen with anything, and what it means to me when I think of this, you might be like, well, what does that mean? What it means to me is it's the mental craving. So a lot of times, and I've said this before in other videos, there are a lot of people who, if they just had to go through the physical withdrawals of having flu-like symptoms for a week, they'd much rather do that if they could have that or the mental cravings. And you might go, wait, you want to go through that? They're like, the mental cravings though, with mental cravings, they can last a lot longer, months or years. And I know you might be like, no, trust me, if they do happen, having bouts of anxiety, depression, sleep disturbances long term. And granted, if you've been using an upper or even meth or something for a long time, yes, you will have a crash, but that's just initially. You still will have problems with insomnia and even nightmares or night terrors long term from this. The biggest thing is, I had a patient a while back who was saying with night terrors, they would have them of using a lot. And I'm not gonna lie, that would be a problem because you're craving it, and this is past the physical withdrawals, craving it and having dreams of using, as they described it, as torture. And I can totally see that. So a lot of times things such as Prazosin or Minipress will be used in accompanying with night terrors. So if you can go see your doctor about this, I encourage you to maybe get something to help you sleep. Now, real quick, I wanted to add this as well. So the mental cravings are reported sometimes to be the worst. Real quick as well too, the shakes as discussed, or hand tremors, or your jaw even locking up, that is something that is very uncomfortable. That can be the hardest part. Or even with the tremors, restless leg syndrome. So you're laying in bed and you're having problems sleeping, and this is the physical withdrawal or even the mental, and you just can't feel calm. You don't feel calm. Your anxiety is high. You're having nightmares or night terrors, and you can't lay down and be still or even sit still. There's something that's one thing that will lead a lot of people to have higher anxiety levels and even higher depression levels, and sometimes lead to more mental health problems as well. So I don't want to ever discredit at all the tremors that come with the detox or withdrawal from meth, opiates, opioids, you name it. Now, once again, I've done a video on this. I do this too because meth has no approved treatment. It doesn't have one. The FDA still hasn't approved one. And I mean, it'd be ideal for them to have a treatment, obviously, but that's why there needs to be a lot more information out there about methamphetamine withdrawal, because meth use is on the rise. And also, opioids. There are treatments that are approved. However, some of them are things such as Suboxone, Subutex, methadone, and these things help. And for some people, that's what they need, and it keeps them clean. That's perfect. That's awesome. But for others, sometimes they're wanting to get off of that, and let's say they've been using heroin for multiple years. They're put on Suboxone after a couple days. Or they've tried to get clean in the past, it doesn't work. They go in there, put on it, and like, this is a miracle, which it is, because once again, chances of overdosing or relapsing decrease with Suboxone or Subutex or even methadone. But the one thing I will say with it is, if you're trying to get off of it and you've been doing it long term, it can cause withdrawal within itself. So with that, and the reason being, it's because when you've been taking Suboxone or Subutex long term, it can get into your tissues and bones. So like, let's say you're like, oh, I'm getting off that, I'm not having any problems. Sometimes the detox from Suboxone or Subutex or methadone, it has a delayed detox, and sometimes people will say it's worse than actually using things such as heroin, unfortunately. And the reason being, it's because, you know, they could be 3 or 4 weeks off of the Suboxone or Subutex or tapered off, and that's typically what providers will do, is they'll taper you off of it, is that it'll have releases. You'll have releases of the withdrawal or Suboxone in your blood from your bones, and you can sometimes constantly feel like the anxiety's higher, the depression's higher. You can sometimes feel like you're detoxing. The shakes can come back temporarily, but that's because it takes a long time to get it out of your system. The half-life of these medications are a lot higher. Now, in the next video, we will be discussing serotonin syndrome in regards to opiates or opioids and applying it. And also, we will be doing a video about what post-acute withdrawal is and jump a little bit more in depth. But thank you for being patient, everyone, with me. I haven't done a video in a while. It's just I've had a long couple weeks recently, but I'm going to continue to do videos because at the end of the day, mental health, I love helping others. Like and subscribe, leave a comment. That is your daily dose of mental health with Adam. We're going to be taking it to the board a lot more from now on, but check out all the other videos. I'll leave a playlist at the very end of this video and whatnot to where you can check out all the different types of withdrawal that are out there. But yeah, that is your daily dose. Have a great weekend.